Lower leg amputation in Tasmania, connecting Tasmanians to information and support for their amputation journey. This video provides general information. To find out more relating to your situation, please contact your healthcare team.
We acknowledge and pay respect to the Leah-Tamarina, Panaher and Tairana-Tapana clans as the traditional owners and custodians of the region these videos were recorded on. We acknowledge the elders past and present. Aboriginal people of today continue to be the caretakers and custodians of land. We continue to learn from and respect the culture of Tasmanian Aboriginal people.
Podiatrists are specialists for care of your feet. We may be part of your healthcare team prior to surgery. We can be a valuable resource of information about your journey ahead and may be able to point you in the right direction for more information. A podiatrist may be part of the team assisting with wound management after a toe or a foot amputation. It can take some time for a toe or a foot surgery site to heal, and it is important that during this time that any weight bearing is kept to a minimum. The reduced or limited weight bearing will look different for each patient. It is important to follow the advice of your podiatrist or rehab team, and you may require the use of offloading devices such as crutches or post-operative shoes or walkers to help with this. A podiatrist will assist with the management strategies for the ongoing care of your feet and will work together with the other professions, helping you to recover. If you have a foot amputation, your podiatrist will provide advanced wound care management. Your podiatrist will work closely with your nurse on your wound care management. If you've had one leg amputation, you may be referred on to podiatry for looking at the care of your remaining foot.
Surgeons get involved with patients when other medical options have failed, and you need to consider whether surgery can be used to preserve the limb or an amputation is required. Most amputation surgeries are required due to poor blood supply in the leg. Without adequate blood flow, parts of the toes or foot don't receive enough oxygen and nutrients from the bloodstream. Due to the poor blood flow, people may experience pain or have wounds and ulcers that aren't healing. Vascular surgeons are then consulted to discuss if there's any possibility of improving the blood supply to the leg. Interventional procedures such as an angiogram with a balloon or a stent or a bypass surgery may be considered. Where possible, options to improve blood flow and preserve the leg are always explored before an amputation is considered. Other amputations may be needed due to an accident in the case of burns, cancer, or severe leg deformities. Surgeons work to decrease the damage and dysfunctional parts of the leg whilst reconstructing the remaining limb to be as functional as possible. The need for surgery may occur quickly, sometimes following an accident or severe infection, or most of the time they're planned over a longer period to help you prepare for the amputation. Amputations can happen at different levels. This can include small toe amputations, mid-foot amputations, above ankle or below knee amputations, and in the rare case, above knee amputations. The decision of the level is based on the severity of the disease as well as trying to preserve the best function. Sometimes doing a higher amputation, such as a below knee amputation, will actually give you better functioning with a better fitting and better functioning prosthesis. Toe amputations are the most common form of amputation, and these may be performed anywhere in the state by a number of different surgeons. Higher level amputations are more commonly performed in Hobart and Launceston. If you had the surgery, your suitability for a prosthetic or artificial limb is contemplated in concert with the rehabilitation team and the prosthetic services. The admission process includes you coming into hospital on the day of surgery, or sometimes you may already be inpatient, having other treatments such as antibiotics. You'll meet up with your surgical team, including the anesthetic and the other assistants in your surgery. We'll plan the best anesthetic for you, and once surgery is underway, we'll carefully remove the diseased limb according to the plan that we have made prior to surgery. Other parts of surgery will include using nerve blocks, nerve catheters, as well as a drain to remove any excess blood that doesn't build up under the skin. You'll be then returned to the ward, and you'll be frequently seen on a daily basis by both the anesthetic and the surgical services to ensure your pain is well controlled and that your wounds are healing well. Following recovery from your surgery, the teams will work on getting you back home. This may require a stint in rehab. Following your acute recovery from surgery, the teams will work on getting you back home. If you need further support to be physically stronger before returning home, we'll discuss your different options. This may include rehabilitation or transferring you to another hospital closer to home. Sometimes we may need to help you return home with plans for further follow-up as an inpatient or as an outpatient to improve your abilities. This depends on your own personal circumstances and your own personal strength and abilities.
Anaesthetists and pain control teams are there to support you through the operation and ensure that you're comfortable. For some, having this operation will alleviate pain and significantly improve quality of life. For some, a new pain may develop following the operation and in some cases may be significant and cause distress. Our role in liaison with you is to anticipate all different outcomes and treat them as they arise. Most operations are performed under a general anaesthetic, where one is fully asleep during the procedure. Sometimes an operation can be performed under a spinal anaesthetic, where a fine needle is inserted into the lower part of the back into the spinal canal, and local anaesthetic is introduced. This produces a dense anaesthesia, which makes the body numb, usually from the waist down. There are some patients for whom this is the preferable option, depending on their background illnesses, but ultimately it is a decision between yourself and the anaesthetist. An epidural anaesthetic may also be recommended. This is similar to a spinal anaesthetic, except a small plastic tube is inserted into the epidural space, which is immediately behind the spinal canal. Local anaesthetic is then injected through this to achieve pain relief. This helps with pain not only during the procedure, but can be continued for up to a week afterwards to assist with pain relief. This is usually reserved for those who already have significant pain issues and are opioid tolerant, and management is likely to be challenging afterwards. Sometimes a spinal anaesthetic or an epidural anaesthetic can be combined with a general anaesthetic to minimise discomfort during and immediately after the procedure. Sometimes the procedure can be performed under a nerve block, where a specific nerve to the area being operated on receives an injection of local anaesthetic to numb it. Post-operative pain management is flexible to each person's needs. We apply a stepwise system to ramp up analgesia requirements if necessary. These range from basic medications to weak and strong opioids and other medications. You may also experience phantom sensation and phantom pain. Phantom sensation is the feeling of the limb still being there after the amputation. For some people, this may feel unpleasant, but can be managed and usually lessens with time. Phantom pain is an experience of pain or discomfort felt in the leg remembered after the operation. This is often variable, with sometimes short moments of significant pain, which then resolves. This typically improves with time as the body adapts to the new anatomy. The good news is, nearly everyone has significant improvement in their pain in the longer term. For some, the pain may persist, but there are ways to manage this with your healthcare team and general practitioner. Persistent pain will improve with time, and the challenge is to maximise your function and fitness as part of your recovery, and that, in turn, will help with your pain. If you require specialised input by a multidisciplinary pain service, your team will discuss your options. In summary, our role is to work with you to provide the optimal anaesthetic technique for you, plus, in the short term, as with most significant operations, to manage your pain proactively and flexibly.
Our role as surgical nurses is to collect you from theatre after your operation and bring you back to the ward to recover. There, we will monitor your vital signs, your wound, and provide you with pain relief to keep you comfortable and ensure you are able to participate in your recovery. We regularly provide assessment and care of your skin through repositioning, skin checks, and ensuring you are not in one position for too long. Often patients can experience confusion after surgery. We monitor for this and alert the team for its management should it occur. Some simple surgeries, such as toe amputations, may be conducted through a day surgery ward. If you require special footwear to move around in, this will be arranged through other team members such as physiotherapy, orthotics or podiatry. A support person is arranged to take you home at the end of the day. All people who have had toe or foot surgery are referred for a follow-up podiatry review. If you need to stay in hospital, we will support you by assisting you to mobilise, shower or bathe and get dressed and undressed. We will also try to include your family or carers in these processes as an important step in understanding your recovery needs. We will talk to you about safe ways to perform your daily activities such as getting around, showering and toileting so that you can minimise your risk of falling. We will arrange referrals for you to see other team members whilst you're in hospital, such as physiotherapists, occupational therapists and social workers. We will prepare you for discharge, arrange any further services or help that you may require in your home, along with the ongoing care of your wound and dressing changes at home by community nurses. If you require more time to recover, more intense therapy, or have complex care needs, we may refer you to a rehabilitation team. They provide specialist guidance and advice on your recovery and may arrange transfer to a rehabilitation unit.
Wound consultants provide specialist assessment, advice and treatment for non-healing wounds. We work closely with other health professionals like doctors, nurses and podiatrists, and this may happen when you're in hospital, during rehabilitation, in outpatient clinics, in general practice and community-based settings. Wound healing is better when the wound is kept clean and free of infection, when there is no rubbing or pressure on it, when you have good nutrition, with good diabetes or blood sugar control, and when you are able to stop or reduce any cigarette smoking. We may guide you on further information or support on any of these areas. Some slow to heal wounds may need special and frequent dressings, and that may include vacuum dressings. You will be fully supported by community-based services on discharge.
Rehab physicians are doctors who specialise in the management of functional loss, activity limitation, or participation restriction arising out of an illness or an injury. After an amputation, we may be involved in help guiding your recovery. There are several ways we may be involved, either whilst in hospital or after you've returned home. Whilst in hospital, we may be asked to provide suggestions about how you can improve your recovery. We may be asked to see whether you might benefit from spending time in a rehabilitation unit. Inpatient rehab units are where people stay in a special hospital ward which provides more intensive rehabilitation than the standard ward in supporting your recovery. In these units, we lead a team of health professionals guiding your best possible recovery from amputation. On admission, the team will work with you and set out goals for your time in the rehab unit. The focus of these days is to be able to return home at a manageable level of abilities. There may be challenges in returning home, and the team's going to partner with you, your family, your friends and carers, and other supportive people in helping you have a smooth transition from hospital to home. Please be aware that you may be discharged home after your surgery before being linked into the rehabilitation team. If this is the chosen path, and as the health system is busy, there may be longer than expected waits to be readmitted to the hospital for further rehabilitation. If you've had a leg amputation, be aware that the teams will initially focus on your ability to manage in a wheelchair. They'll work with you on how to return home and other accommodation using a wheelchair. Rehabilitation teams assess whether the prosthesis or the artificial leg is suitable for you. Some considerations are around, firstly, your health and medical conditions. Secondly, your physical abilities and the condition of your remaining limbs. Your thinking and planning abilities and your support network. Another avenue for rehabilitation is through the outpatient rehab programs. These continue to work towards your rehabilitation goals after you've left the hospital. Most prosthetic rehabilitation in Tasmania is conducted by outpatient rehabilitation programs. If you're receiving a prosthetic rehabilitation, initially your prosthesis will remain at the therapy area between your sessions. If you're living in the community and your team or GP are wishing to optimise your abilities, they may consider a general hospital admission or referral to a rehabilitation physician through the hospital clinic or the amputee clinic.
The goal of a rehabilitation nurse is to help people following surgery, disability or chronic illness to gain optimal function and adapt to an altered lifestyle. An inpatient rehabilitation hospital stay following amputation are more common if you have multiple health conditions affecting your function or a below or above knee amputation. Rehabilitation nurses involve you, your family and carers to form short-term goals around transferring, self-care, wheelchair or mobility skills, nutrition, continence, skincare and many other areas. Longer-term goals are developed during your rehabilitation journey. We will educate you on how to preserve function in the remaining limb, whilst encouraging independence. Your safety is paramount to ensure that falls and skin tears are prevented. We will ensure that you are receiving any medications prescribed. We will educate you on skin inspections, how to prevent pressure injuries and support your wound management. If you're assessed as being suitable for a prosthesis, any delays related to wound healing will delay prosthesis training. Rehab nurses support and apply the strategies you have developed in partnership with all of the rehabilitation health professionals to your 24-hour day. We are available to talk to you, your family and carers. Explain the strategies that you and the rehabilitation team members are working on together. Be a conduit for information to and from the rehabilitation team members. See how you are managing overnight with toileting, self-care and mobility. Be there overnight when phantom pain can be more noticeable. Together with other professionals, especially occupational therapy and social work, we ensure that you are linked into or referred to all available supports to help a smooth transition from hospital back into the community.
Dietitians help people with the types of food and fluid and the amount that they are eating and drinking. We look at what someone is eating and how this can affect their health. A dietitian may be part of your healthcare team before or after your amputation surgery, depending on how well you have been eating and drinking. Dietitians work with you to make sure that you are getting the right sort of food for your surgery and to help you recover and heal as quickly as possible. After surgery, when your wounds are healing, it is important that you are eating enough of all nutrients, but particularly protein. Protein is a nutrient found in meats, dairy, egg, tofu, and legumes. It is a nutrient that helps tissue rebuild and heal wounds. You may need to eat more protein after surgery than normal. A dietitian can work with you to help make sure you are getting enough of this important nutrient for your recovery. Eating and drinking is also important when you start rehabilitation. Getting enough of the right nutrients can help with your physical rehabilitation you are doing. Eating the right foods can help you gain strength and progress quicker. This is something that a dietitian can assess and guide you on.
Occupational therapists work with you to return to all the tasks in your usual life. This can include basic tasks like going to the toilet, through to cooking and cleaning, shopping, working, and your hobbies. Occupational therapists can help you prepare for surgery by looking at your home and planning equipment and modifications you're likely to need when you return home. After surgery, if you have a leg amputation, occupational therapists work closely with you and the rest of the team to be comfortable and safe in the bed and in a wheelchair. This includes reducing the risk of pressure sores and other pressure problems. A wheelchair will be selected for you and it will take into account your size, your balance, and taking care of your residual limb. After surgery, occupational therapists will also work with you to be able to be as independent as possible in basic activities like toileting, washing, and dressing from the wheelchair or the bed. This will include keeping you safe and preventing falls. You may be taught how to use equipment for these activities such as commodes and grab rails. Occupational therapists will work with you to get you ready for discharge from hospital. We will gather information about your abilities and your care needs, the tasks you need to do in your everyday life and your home environment. Using this information, we will work with you to develop a rehabilitation plan and tailor discharge planning for you. We will look at how any other medical conditions or problems such as poor memory affect you, and we will include these in your plan. Occupational therapists will ask questions about your home, look at photos of your home with you, and we may ask to visit your home. We then make recommendations for equipment or home modifications that are specific to you. If you are considering any modifications to your home or purchasing some equipment, it's a good idea to talk to your occupational therapist early for helpful advice. We will direct you to funding options for equipment and for home modifications as well. If you need rehabilitation, either in the hospital or as an outpatient, occupational therapists will work with you to return to a wide range of activities. These can include housework, including being independent in many tasks while you're sitting in a wheelchair. Occupational therapists will also look at getting you back into the community. This could include practicing getting into and out of cars, some advice about returning to driving, and regaining independence in activities like shopping. Returning to work or volunteer roles can also be supported by occupational therapists, as well as your leisure activities and your hobbies. If you are undergoing prosthetic rehabilitation, we will work with you to practice using your prosthesis for all or some of these activities if required.
Orthotists and prosthetists provide support, advice and solutions for anyone with a limb loss or limb difference. If you've had toe or foot surgery, we may be involved to ensure you're keeping weight off of the area. If you require long-term offloading, orthotists can guide you on your options. If the decision's been made for below knee or above knee amputation, then before the operation we can assist with information and advice about what will happen afterwards. After amputation surgery, we'll all work with you on protecting the surgery area from being knocked about, controlling your swelling and helping with the shape of your leg. Each person is assessed for their suitability for managing a prosthesis, as discussed by the rehab physician education video. If the rehab team decides that you are suitable for a prosthesis, they will guide you through the process. Using a prosthesis involves training and education by several members of the team. We will guide you on the long-term care of your prosthesis and any funding options you might need to consider. Long-term care includes repairs and adjustments, parts and maintenance, socks, straps or sleeves, and eventually a replacement prosthesis. We will also check that you are aware of peer support options for talking to someone who's had a similar limb loss.
Physiotherapy is a profession which focuses on people's physical recovery from surgery, illness and injury. It's important to be able to get up and moving after your surgery. This can be very different depending on the type of surgery you have had and how you were able to move around before you had this surgery. If it was hard for you to move around prior to your surgery, you may find it challenging to get up and moving again afterwards. Your physiotherapist will be there to support you. Depending on your circumstances, your physiotherapist may guide you on ways to prevent some breathing complications such as chest infections as you recover. Some simple toe amputations may not require any physiotherapy. The rest of your healthcare team will guide you after those surgeries. If you require special footwear to keep pressure off the surgery area, your walking and balance will be affected. Physiotherapists will show you how to safely move around. You may need a walking aid or a wheelchair. The team will guide you on ways to help protect the foot to help healing, and there may be limits to the amount of walking we recommend you do after your surgery to aid your recovery. Further physiotherapy may be needed as you heal to improve your balance, strength and fitness. After an amputation of your leg, getting around will be different. Most people will use a wheelchair getting around and managing at home. It's really important that you have a way of getting out of bed in the first few days after your surgery. This helps prevent general complications of surgery and helps your recovery. We will work with the team on any special ways for you to get in and out of bed and moving around from your bed to a chair. The team may use mechanical devices to lift you in and out of bed if you're finding it hard to move about. Your physiotherapist will show you ways to help stay strong, fit and flexible. We may provide you with an exercise program and discuss how to prevent falls, trips or stumbles that could damage your healing leg and delay your recovery. If you would benefit from further physiotherapy after leaving hospital, we will discuss your options with you. If the rehab team decide that you are suitable for a prosthesis, we will help you physically prepare for it and help you learn how to use it.
Social workers provide psychological support and practical assistance to those impacted by amputation or limb loss and their families. We're here to help you with your well-being while you get ready to head home. Some clients may stay in hospital for a short period of time and not need us. Others may need to stay longer and need input from social workers. If you need social work support, your treating team will let us know and we will get your consent before getting involved. Our role is around supporting you emotionally while you recover from surgery. We can also help you by providing practical help if you or your family need it. Depending on your age and cultural background, there is a range of support services available to you and your family. These include aged care services for people over the age of 65 or 50 years of age if you're Aboriginal or Torres Strait Islander. The National Disability Insurance Scheme is available to people who are under the age of 65, and there are other community services available. If you identify as Aboriginal or Torres Strait Islander, or if you are from humanitarian backgrounds, your treating team can get you in touch with our Aboriginal Health Liaison Officer or our Refugee Health Social Worker to provide you with support specific to your needs. If you wish to be linked in with peer support to discuss your recovery journey with people who have had a similar limb loss, your healthcare treating team can guide you on how to access these options. After leaving hospital, if you need ongoing support, we can help to link you and your family members with support services in the community. Sometimes your carer might be worried about life at home after you leave hospital. Support services are also available in the community for your carer or family members who may be experiencing stress related to your health journey. Your treating team can assist with referrals to these services. It's normal to experience a range of emotions after surgery, including anger, sadness, depression, stress, or anxiety. We will support you to adjust to life after amputation while in hospital. If you require ongoing support to ensure your psychological well-being, your treating team can explore referrals to psychological services within the hospital or community for you and your family members.